COVID-19 and increasing demand for medical oxygen, can impurity be a problem? The COVID-19 pandemic in 2021 has accelerated the demand for oxygen supplies globally. Many countries have not seen such high demand before the pandemic to meet their daily oxygen requirement. Worldwide, governments are scaling up their existing facilities to fill the oxygen demand. In the healthcare system, oxygen is an essential medicine required at all levels. It is estimated that 20 to 40% of deaths due to pneumonia could be prevented using oxygen therapy. Medical air in hospital settings is widely used for mechanical ventilation, infant resuscitation, aerosol drug delivery, and neonatal environment control. Oxygen cylinders, oxygen concentrators, liquid oxygen, and membrane separator oxygen enrichers are commonly used for oxygen therapy. In the current COVID-19 pandemic, long-term oxygen therapy is required at both hospitals and in home settings that the respiratory physician should supervise for optimal treatment. Unprecedented production of oxygen and refilling of cylinders can give rise to the risk of impurities, which could lead to an increase in hidden mortality. However, it would be difficult to assess the increase in mortality due to the impurity of the oxygen gas. Hence, the purity of the oxygen needs to be regulated by the respective authorities. Higher oxygen production can give rise to a possibility of contamination. In a recent study, the CO2 impurity was reported in oxygen cylinders above the recommended threshold level. In previous studies, various health effects were reported due to the common air pollutants. It was also observed that unintentional inhalation of NO in industrial regions might change the POW. To also mention on-site production of medical air poses a risk of raising the CO2 and NOx, nitric oxides, concentration above the United States Pharmacopoeia, USP, threshold. This rise of these trace gases may be due to the dryer that is used to capture the CO2 contaminant and humidity. Impurity sources can be arising due to the production and delivery systems, as well as from the environmental pollution levels near the regions. According to the FDA guidelines, medical gases should be checked for any adulteration during production, packaging, delivery, and manufacturing facilities. Here, we would like to highlight few points for policymakers and local authorities and for the general public to create awareness and recommendations to improve the quality of oxygen. Another reason for the increase in the COVID-19 mortality can also be due to the black fungus, which are present in the environment. This could lead to mucormycosis, which could be a fatal disease for people who have weakened immune systems. In the nasal tract, black fungus develops due to the poor quality of water used to hydrate the oxygen in a hospital setting, piped and cylinders. This fungus grows in the nostril, travels towards the eyes and then towards the brain, which can paralyze the nerves, cause permanent damage to the eye, or even could lead to a heart attack. An evidence-based advisory for screening, diagnosis, and management of mucormycosis developed by should be followed and need to be updated considering the recent evidence of mucormycosis in the COVID-19 pandemic. In a hospital setting, constantly monitor distilled water for oxygen hydration before using it in oxygen therapy devices. Use of tap water even after boiling is not recommended in the humidifier, as after some time, impurities, micrometals and minerals/salts, start to build up, leading to severe health issues even after using life-saving precious oxygen therapy. Globally, we are facing an emergency that needs support from authorities and the community to minimize the suffering and improve the well-being of all. In lower and middle-income countries, oxygen purity can be a significant issue that requires local interventions at the earliest. Countries where there is prevalence of malaria, sepsis, pneumonia, and other ailments should also prioritize where oxygen therapy requires at large,